Hello, I am Elma Olatunji, and this is another video where I'm going to be telling you everything you need to know, everything you need to understand about pneumonia, causes and management of pneumonia. What is pneumonia? How is pneumonia diagnosed? How do people catch pneumonia? Signs and symptoms of pneumonia, and of course, how can we treat pneumonia? So attack this video, pneumonia at a glance. Pneumonia at a glance. So you just stick around, don't go away. Make sure you watch this video to the end. So having said that, now what is pneumonia? Pneumonia is an infection of one or both lungs, which usually caused by bacteria, viruses or fungi. And prior to discovery of antibiotics, 1/3 of all people who develop pneumonia subsequently died from the infection. Prior to discovery of antibiotics, 1/3 of all people developed pneumonia subsequently died from the infection. So moving away from that now, how do people catch pneumonia? So the next question is, how do people catch pneumonia? You know, uh, some cases of pneumonia are contracted by breathing in a small droplet that contain the organism that usually cause pneumonia. And these droplets get into the air when a person infected with these germs, coughs or sneezes. So it's through droplets, through air droplets, and is when it usually gets into the air when a person infected with these germs coughs or sneezes. And then in other cases, pneumonia is caused when bacteria or viruses, which are usually found or which are usually present in the mouth, sore throat, nose, advantageously enter the lungs, or advantageously enter into the lungs, So bouncing away from that now, let's now quickly look into signs and symptoms of pneumonia. Signs and symptoms of pneumonia. So signs and symptoms of pneumonia may include upper respiratory tract infections, such as sneezing, cough, sore throat, cold, catarrh, and so on and so forth. High-grade fever, sputum with production, and the production, which is usually discolored or sometimes bloody, depending on the location of the infection. It depends on the location, of the infection. The sputum may be, discolored or sometimes bloody. It depends on the location of the infection. So having said that, now how is pneumonia diagnosed, and how can we treat pneumonia? How is pneumonia treated? So how can we treat it? How is pneumonia diagnosed? So how is pneumonia diagnosed now? Pneumonia can be suspected when the doctor examines the patient and hears the coarse, breathing or cracking sounds. Cracking sound, from one portion of the chest, when the doctor examines the patient with the stethoscope. So when the doctor examines the patient, so with the stethoscope, and hears coarse breathing or cracking sounds from one portion of the chest, that may indicate pneumonia. That may indicate pneumonia. And a chest X-ray is usually ordered for the diagnosis of pneumonia, to confirm the diagnosis. And so a chest X-ray is usually ordered to confirm the diagnosis of pneumonia. And then blood tests such as WBC, that is white blood counts, can be performed to confirm the diagnosis of pneumonia. As sputum samples can also be collected and examined under the microscope. Sputum samples can be collected, sputum samples for culture and sensitivity can be collected and examined under the microscope. And then bronchoscopy can use to feel the breathing passages for any air for anything. So bronchoscopy can be used to fill the breathing passages to to diagnose the pneumonia. So having said all this now, um, the next question, the big question is, how is pneumonia treated? How is pneumonia treated? Bacteria and fungi pneumonia, not viral pneumonia, can be treated with antibiotics. So pneumonia is a general phenomenon, very common around us. So the best thing you need to do when you suspect any case is to go to your nearest or nearby hospital. You lodge your complaint, doctors carry out some tests, examines you, carry out some tests, and they give you the best treatment, the necessary treatment. Pneumonia is caused by bacteria, viruses or fungi, and it can be contacted through air droplets. When an infected person sneezes or cough, and in some cases too, it may be uh, it may be caused by bacteria or viruses which are normally present in our mouth, in our sore throat, in our nose, when they inadvertently advertently enter into the lung. So, and signs and symptoms of pneumonia may include upper respiratory tract infections such as sneezing, cough, cold, sore throat, and the likes. It may include high-grade fever and a sputum with production. So, on this note, I've been tied up on my things, and I say thank you for watching. And please, if you find this video useful, you might want to give me a thumb up and subscribe to my YouTube channel, that is Packaging 14. Please go there, subscribe, Packaging 14. So till I come your way next, always remember, health is wealth. I say stay safe, stay healthy, and I see you next time. Bye for this minute.